In section 4.3a, we're talking about how we can use studies wisely. There's basically one thing we're really going to talk about is to describe the scope of inference that is appropriate. There's also something called ethics that statistics has to deal with as well, but it's not part of the AP exam, so I will save us some time by not dealing with the ethics in this chapter. So the idea of a sample survey, what type of inference can we make from a particular study? And the answer depends on the design of the study. So this chart is something you're going to use for the entire course to tell whether we can make inferences or not. So if you can look here, there's two questions you have to ask yourself. Were individuals randomly selected, and were individuals randomly assigned to the group? If the answer is yes for those, then you can make an inference about the population, and you can make an inference about the cause and effect. If individuals were randomly selected, but they were not randomly assigned to groups, then we're in this column. And it says inference about the population, yes, but can you make an inference about cause and effect? No. And then if neither the individuals were randomly selected, but they were randomly assigned to groups, so they weren't randomly selected, maybe they just showed up. So you cannot make an inference about the population, but you can make an inference about cause and effect. And if the individuals were not randomly selected, so no, and they were not assigned to groups randomly, then you can't do anything. You cannot make any inferences about population or cause and effect. Well-designed experiments randomly assign individuals to treatment groups. However, most experiments don't select experimental units at random from a larger population. That limits such experiments to inference about cause and effect. Observational studies don't randomly assign individuals to groups, which rules out inference about cause and effect. Observational studies that use random sampling can make inferences of establishing causation. A well-designed experiment tells us that changes in the explanatory variable causes changes in the response variable. There are some things that can happen. Lack of realism can limit our ability to apply the conclusions of an experiment to the settings of the greatest interest. In some cases, it isn't practical or ethical to do an experiment. Consider these questions. Does texting while driving increase the risk of having an accident? We can't go out and tell people to text while driving and do a study. Does going to church regularly help people live longer? You can't tell people not to go to church or to go to church. And the same thing, does smoking cause lung cancer? You can't have people smoke for your experiment. So it's sometimes possible to build a strong case for causation in the absence of experiments by considering data from observational studies. When we can't do an experiment, we can use the following criteria for establishing causation. Is the association strong? Is the association consistent? Larger values of the explanatory variable are associated with stronger responses. The alleged cause precedes the effect in time, and the alleged cause is plausible.